Okay, so Tiger Woods was involved in a major rollover accident last week. Was taken to the Level 1 Trauma Centre at the UCLA with right lower leg injuries. We're going to preview his injuries and what might have actually happened. And as always, if you like our video, press the like button or press subscribe. So the statement said that Tiger suffered significant orthopaedic injuries to his right lower extremity. They went on to say that there was comminuted open fractures affecting both the upper and lower portions of the tibia and the fibula, and these were stabilised with a rod into the tibia. Now, to break this statement up into the simple words and what these actually mean, a comminuted fracture means that his fracture was in pieces. Usually you have one fracture line, there's two pieces of bone left over. In Tiger's case, there was more than that. An open fracture means that there's a wound between the fracture and the outside world, meaning it's communicating, and the bone may actually be sticking out through the skin itself. That's pretty serious. They've also stated the upper and lower portions of the tibia and the fibula bones were involved, which means he may have had something called a segmental fracture, and we'll go into that later in the video. And then they've also talked about a rod into the tibia, and that likely means that he's had a device called a tibial nail inserted, and we will show you this later in the video as well. So we'll then go through each of these statements in more detail and outline them for you. So a comminuted fracture, just to outline you in terms of pictures, there's a tibia there on the right. Now, in the middle here, we're going to draw what a commonly fracture looks like in a tibia. It's a two-part with a single fraction line. That's not what Tiger had. The one on the right here is likely what Tiger's had, and this is a tibia that's in about 4 pieces, multiple fraction lines. Now, we don't know exactly what his looks like, but a comminuted fracture means that anything other than what's in the middle there, so it's something very complicated, unfortunately. Now, a segmental fracture is something else we're speculating he might have had, so we're going to draw our tibia once again here on the right. Now, a segmental fracture means that he's got a break in the same bone at multiple levels. So, an example of a segmental fracture, the tibia, is in the middle here. So he's got a break at the bottom here, as denoted by the arrow, and then another break at the top here is denoted by the other arrow. Now, the statement actually said both the tibia and fibula bones were affected. Now, the fibula is directly next to the tibia, and so to be more accurate, a proper accurate drawing of a segmental fracture of both is on the right here, and that may be what Tiger had, which has been fixed with a tibial nail. Now, a compound fracture is another name for an open fracture, and so an example of that is on the right here. The red would denote the wounds, and the black would denote the fractures of the tibia. Now, that means that the fracture is communicating with the outside world, and what unfortunately that means is that it can cause a problem. Now, the problem with this is that the bone is thought to be contaminated in this type of injury, and that means the infection risk is increased markedly. And before anything definitively can be done, contaminated tissue in the area that needs to be cleaned, scraped, and removed before the fracture can be fixed definitively. So it's quite a serious injury. They've also said that the fracture was stabilised by a rod in the tibia, and that means he's likely had an implant called a tibial nail. So we're going to show on the right here what he's actually likely had. So there's a tibial nail there on the right. This is not Tiger, this is another patient. We're going to point out the fracture around this nail in this x-ray, but that's the implant that Tiger is likely to have had. That's what his x-rays will show. Now, in terms of inserting that rod in the tibia, it's done from the kneecap, and there are 3 different types of incisions that can be done, one in the middle or side to side, as noted by the colours there. So that's the way it would have gone in. There's a little cut usually up near the kneecap. Now, as the rest of the statement, so they talked about additional injuries to the bones of the foot and ankle, which was stabilised with a combination of plates and screws. In terms of the ankle, other ankle injuries he could have had, he had a high energy trauma. The image here on the left is an ankle fracture, so often an ankle fracture is in more than one place, you can see there. Or an injury called a tibial plafond, which is on the right, which involves the joint surface of the tibia. Now, if he had the ankle fracture, it would have been likely fixed with some screws and pins, like they said on the picture in the middle here. If he had the one on the right, it's much more serious and require a lot more fixation. So I think the one on the right is doubtful because they haven't really mentioned it that way, and it would be rare to be done in the first instance straight away as soon as he presented. So it's more likely he had a fracture on the left, but we don't really know. They then said, this is the same statement, they talked about foot injuries as well as ankle that was stabilised with a combination of screws and pins. So in terms of the most likely foot injuries that can occur with the level of trauma that Tiger has suffered, the first is a talar neck fracture and the second is a Lisp fracture. So talar neck fracture is this bone that's sitting out the front here on this x-ray, and it's a very serious injury. You can actually have a real problem with blood supply in that area. Or the Lisp fracture injury on the right here, and we've actually covered that in another video with Corey Horsburgh, so please look at our files and we can explain that to you in more detail. But both are very serious injuries. They then went on to say there was trauma to the muscle and soft tissue of the leg which required surgical release of the covering of the muscles to relieve pressure due to swelling. Now, a surgical release usually means that the patient has had something called a compartment syndrome, and the type of release they have is often called a fasciotomy. So we're going to explain this to you, and it sounds very likely that Tiger's had this diagnosis with that treatment. So a compartment syndrome. Now we can best describe this if we look at a bone in isolation. So this is just the bone somewhere in the body. It's surrounded by muscle in red and fascia in yellow. So we're going to mark out the bone for you clearly so you can see it. And then you've got the muscle in red, and then the fascia. Now the fascia is like gift wrap, it's like cling wrap around the muscle. It holds it in, but it's only got a very fixed volume. It can't take a huge amount of build up of pressure or swelling or fluid within it. And this leads us to show you what a compartment syndrome can then be. So we're going to show you it on this next slide. So if you have a break in the bone, you will get bleeding from where you break that bone, and that will then leak into that compartment which is made up and covered by the gift wrap and fascia. The gift wrap doesn't have a hole in it, so the pressure just builds and builds inside the area, and it can only expand a small amount. Once it reaches that threshold, all the pressure then within that cavity is putting pressure on the muscles, and so the small blood vessels that supply oxygen and nutrients to the muscles can't do that anymore, and unfortunately the muscle can die after about 6 hours. So the only answer to that is to actually relieve the pressure, and to relieve the pressure you do a procedure called a fasciotomy. And what that means is that fascia, that yellow stuff, is opened with a knife, usually through a long incision on the lower leg, and that lets all that pressure out so the muscle can then get its blood supply back and won't die and will live. So that's very likely what Tiger's had. But you can see here, these are the incisions on the lower leg that you usually need for a fasciotomy. Those in red there, so they're quite extensive. So he will have big cuts on his leg, unfortunately, which means he's had a very, very, very serious injury. So if we go through all of Tiger's injuries again, we're pretty sure he's had a compartment syndrome. As a result of that, as a result of an open fracture to the leg, he's had a tibial nail for fixation. He's had a fasciotomy to sort out his compartment syndrome. We think he might have had something called a segmental fracture, and he may have had some ankle and foot fractures which have been fixed, and we don't know how serious they are. So thank you for tuning in today. If you have any more questions, look things up on hunterfootankle.com.au. As always, press the subscribe button and like button if you liked the video, or leave us a comment as to what else you might like to see. Thank you.